welcome everybody. This is an exciting time and we're pleased to have everyone here. We're going to be getting perspectives on COVID-19. And I see on our screen, can we stop the screen share please and go back to the panelists, the gallery view, to see the lovely faces that we've gathered here today. We've gathered diverse perspectives to give us their vantage point on what's going on. What are the issues? What are the trade-offs we're going to have to make? And what are the solutions that are going to help us address this issue? Now, the key here is diversity, because in the media, you'll get one or two views, and talking with your neighbors, you'll get, very specific view. But rarely will you ever, in one circle, in one place, see all of these views, but also talking to each other and reacting. And this is actually what Boma is all about. A Boma is a gathering place. It was a significant experience for our global CEO, Lara Stein, growing up in South Africa. To sit around a fire in a circle and have deep discussions and make decisions as a community. And now more than ever, that's what we feel at Boma the world needs. So we've brought folks together. It's a little bit in a square, but let's pretend it's a virtual circle. And we're going to get into deep discussion and debate on the issues, the trade-offs, and the solutions that are required. Dan, do you want to give a little bit of a format, how this is going to work?
Yeah, so the format, and we were doing this previously, but dog on cue. If everyone can raise hand raise button, essentially what we're looking to do is create a virtual roundtable. So we want to create an opportunity for people to chime in, to disagree, to add their perspectives, to enrich the content around the questions that we're asking. So please don't be shy with your opinions. We really want candor. We want real talk. And I think the other big thing here is to try to keep your comments brief and punchy. If you're going on too long, as moderators, to keep things moving along, we will cut you off and to keep moving the conversation. It should be a lot of fun, and looking forward to getting everyone's perspective. So with that, and Jess, anything else? Are we good to go?
The only main thing is candor, please, everyone.
Gary, you've got your hand up.
Yeah, the only thing is I would suggest that if you're not speaking, you might want to mute in case the dog starts barking again. Doorbells ringing, people coming into the room, etc. So I think it's better to mute.
Great suggestion. Here's the main thing. Here's the last and main thing. We want candor. We are here for another hour and a bit, and the whole point of this is to dive into really deep discussion. I want candor and real talk. I would encourage you, please, to dissent. If you disagree, then please call it out, because this is how we're going to make the most informed decisions. There is no right answer, and only through diverse perspectives and really challenging each other can we make the best decision. So please call it out and give your true, from you as an individual, your true perspective, and completely avoid the platitudes. And if you go on too long, we're going to cut you off.
Perfect.
You're cutting me off.
I'm cutting Jess off. We're going to jump in. So with that, Julia, are you still on, or have you? She was on the green room, but she might have had to jump. No worries. Duncan, we're going to kick it off with you. I want to go right into, from a hospital perspective, I want to understand the issues on the front lines. I want to understand, you're the chief of surgery at Oakville Trafalgar. You are the head of the virtual care program there. I want to get, from your perspective, what did you wake up thinking this morning?
So while this might be an unprecedented thing, I have to say many of us knew that this was coming. We may not have predicted that it would have been now, but this is Canada. We experienced SARS, and we know that what we traditionally considered tropical medicine or tropical issues are becoming global issues. The viruses of the world, whether it's Zika or chikungunya or parasitic infections like malaria, they are becoming our problem. And historically, issues of the Southern Hemisphere, we didn't consider our problem because it didn't affect us. And fundamentally, I hate to say it, but when it comes down to it, it's all about money. We have a perspective of 4 years, an election cycle. So where do we not put money? Public health, virology, vaccine research, minimum basic income, social inequity. Where do we put our focus? We put our focus on profit, because that is what we incentivize in our society. And that's what we incentivize in healthcare to a certain extent. We want the best possible healthcare for the lowest possible dollar. And unfortunately, when you incentivize these things, you get these things. You don't get flex room. You don't get capacity.
So I want
to respond to issues like this.
So that's super interesting. I want to actually go to James Partridge. So James, you're a director at Moody's. You follow the markets. You're looking at the economic impact of this. When you're looking at it from both from an economic incentive standpoint, as well as just responding to some of the stuff of Duncan, maybe frame the issues from your perspective a little bit as an economist. And I'm curious to also hear your thoughts in terms of what Duncan was mentioning. Do you agree? Do you disagree?
Yeah, I completely agree with that part of it. I think the timelines for politicians are much different than the timelines for other people, and the funding issues are very real. And what I'm thinking about now is, to sum it up in one word, is liquidity, right? That's what everyone's looking for. Everyone's looking for cash, whether you're a household, an individual, a small business owner, a large business. You'll see everyone draw down on their existing credit, looking for ways to ensure that they'll have some sort of cash fund for the next few months while things are very, very uncertain. And it kind of acts like toilet paper, right? Where everyone thinks they're going to need toilet paper in the future, so they all hoard it, and then it stops people from actually need the toilet paper now from having it now. And so you'll see banks start to close their lines of credit because everyone is drawn down on their lines, and so the people that actually need it in the short term won't have it because people are hoarding cash as well. So that's why you see all these programs where like the Bank of Canada and other central banks around the world are putting these facilities in place to make sure that people have access to credit and banks are able to lend.
I was just saying, I hadn't thought about it that way, that lines of credit would be like the next to go after toilet paper.
I'm curious. I want to jump to John.
Can I let me just jump in there? I mean, I think it's important to call out where that starts, though, and I think it's back to some of what Duncan was talking about in terms of incentives. The first people who drew down their lines of credit were not people who needed it, household small business owners. The first people were all the companies that were advised by Carlyle and Blackstone to draw down every single penny they could get. And that is what's driving the liquidity crisis if it becomes a liquidity crisis. And the problem with that is that ministries of finance like liquidity crisis and financial crises because they know how to act. What they don't know how to act is for short-term, local, massive declines in demand, because we've never had that before. And that's what we're facing. So I think as we think about, long-term, what comes out of this, it's how do we organize ourselves so that we're not vulnerable to large pools of capital driving the agenda time and time again.
Amazing. I think then we're going to earmark that when we get to solutions. I want to hear how we actually do that. But that's an important insight on what is the main issue that we're facing today.
So one of the things, just to kind of keep building on this idea of understanding the issues, is around how people are actually understanding this crisis. Want to throw it to Ryan Merkley. So you're chief of staff at Wikimedia. You've been fighting this disinformation campaigns, not just with COVID, but across the internet with a lot of your colleagues and partners. Curious if you could share with the group and those at home how you're thinking about information as it pertains to COVID.
Thanks, Dan. We've seen Wikipedia sits as part of a knowledge ecosystem, and I think it's really important to note that the things that appear on Wikipedia come from reliable sources built by a community of people who evaluate all of that and discuss and debate what can be taken as neutral facts and presented to the world. And that's very different from what you're finding on social media, where any person anywhere can post whatever they want and it can be spread out a million times. What we're not yet seeing is a lot of the kind of disinformation that people think of in terms of state actors influencing elections. Honestly, what we're seeing a lot of is people trying to profit from the uncertainty and the terror that people are feeling right now about what's going to happen next. Now, there are an army of volunteers, and there's other articles that are really well written about how they're doing that, that are making sure that the information that's on Wikipedia is factual and reliable and well-sourced, because we're seeing an enormous uptick from folks who are looking for information. I think one of the things I don't want to disagree with my colleague, Dr. Rozario, that we could have seen this coming or that there are precedents for this, but I think it is utterly unprecedented that the entire world would be locked in their homes all at the same time and unable to go to work. The streets of Paris are empty. The subways in Toronto are empty. This is a total unprecedented event in our lifetime. And we have to, at least some point, just like let go of the idea that there is any version of this we've ever seen and that we can just like wade through directly. We're going to have to do, in some cases, kind of everything differently for a little while as we figure this out together. And I think like letting that go, I think is pretty important. Like markets aren't going to work the way that they used to work. And we're going to have to get used to that. This is an entirely different scenario for everybody.
So I want to kind of tease out a little bit with Steve Joordens. So you're a professor of psychology, University of Toronto. So both as someone who's not hosting classes right now, but also an expert in this area of social distancing and understanding the mental health challenges with this new reality that Ryan's expressing. I want to understand your take on this in sort of adjusting to this paradigm shift. How are you thinking about this?
Yeah. I mean, this is mental health central. So, a few weeks ago, we had some people who believed in things like anxiety disorders and others who don't. Now we all live it. So we all know what it feels like to feel anxiety all the time. Just the things like liquidity that the common person does not understand what that means, but understands that those who do know what it means are worried about it and it sounds dangerous. And so there's all these amorphous kind of threats out there. And when our system feels threat, it kicks in its fight or flee response. It wants to do something about the threat. It wants to take it on. That's what anxiety is. It's supposed to be short-lived. So you're supposed to take on that threat or run away from it, and then it goes away. But when the threat is chronic like this, so is the anxiety. And so this is a time, as Ryan was saying, we have to get used to this. I think we have to do some real serious mental health work. Mental hygiene work. I've been pushing things like guided relaxation where you can find tapes online, but we are all going to have to learn how to put up with these sorts of things on a semi-regular basis and how we can keep ourselves intact psychologically while we're doing that. So that's really my focus, is trying to help people understand the psychology that they're feeling and to give them some idea about how to regain some sense of control, because that's what we need when we're faced with all this ambiguity.
So we've got.
Just like to add on to what Steve said. I think the anxiety comes about because of all the above, but I think what really compounds it dramatically is the fact that we don't know when it's going to end.
Yeah,
and
that's
just
a
huge uncertainty.
And just to really quickly touch on that, the real worry with this is if the anxiety stays engaged, it literally starts to compromise our immune system after a while. Sort of chronic stress things, and that makes us more susceptible to the virus. So we have to learn how to control our minds better than we have today. And we can. That's the good news.
So I see a couple of hands. I want to go. I know Kevin, you had your hand up, and Anil, you have your hand up. So let's go first. Let's go to Kevin. Your question or comment, and then I'd love to also just get your perspective on some of the issues from, you're the CEO of MediaCom Canada. You work with brands across the country, around the world. From an industry standpoint, I'm curious around the issues, and then your other comment, and then Anil, we'll jump to you.
My first comment was more specifically back to Steve. I totally agree with the comments that he's made, but probably amplified by 10. If you think about, you're talking to an individual standpoint, but we have a workforce that is predominantly all at home. And not only are we seeing that they're beginning to start trying to figure out this new world from a work perspective, but they also have their kids with them. And so you put those two things together, of which I'm dealing with myself, and we've never seen a time like this, and I'm hoping for an opportunity where we can kind of spread this, not just from a one-to-one perspective, but a one-to-many. How do we all together figure out this new world versus kind of one by one, because I think it's not quick enough.
Great. Yeah, I agreed. Anil, let's jump to you, and then Amanda, you had your hand up.
And Anil, just for and then Zabeen, and then Anil, just as introduction, you're director of philanthropy at Toronto Foundation. It's the eminent, the organization that thinks about the all of the nonprofits, all of the underserved individuals that need our help at the most throughout the year, 365 days a year, and certainly more so now than ever.
Yeah, so I think that the thing that I really want to touch on here from a mental health and just all these threads, I just want to say out loud that and someone said this earlier, so I just really want to say it again, to have this kind of conversation, there's a real privilege for all of us to be able to do this. And there are hundreds, thousands of people in our city and across the world that are working in the types of work where they cannot work from home. They cannot support their kids in the way. They don't have a stocked fridge like I do upstairs. They don't have power for their iPad, for their, for their kids to mindlessly watch YouTube. Like there's real consequences here to sort of the populations that are really, really struggling. And I think when you have inequity, the way a lot of the world does in many of the cities that exist, and you see it for sure in our city in Toronto, and you see it in global centers around the world, this level of inequity is exacerbated when something like this comes and just decimates anyone sort of quote unquote at the bottom end. And this idea of being able to, like I can think about needing to buy groceries for my parents who are in their 70s and 80s, so they don't have to go to the grocery store. But imagine all the people that don't have that luxury to do that. And like, it's just, I just want to make sure that having this conversation is important, and all the things Steve was talking about is important, but how do we ensure that people who really, really, really need those supports are going to get them? That's the challenge here.
Yeah, and actually, I just want to bring that home, share actually something that you shared with me yesterday when we were talking. A good example of this, because I think we can all believe and see the pantry loading elements and the access to cash. One of the things that struck with me was domestic violence. So this is an unseen thing for most of us all the time. And now that people are particularly feeling triggered and they're at home, it becomes an even more scary and dire situation. And it's
in
not
Toronto,
like you can go and, go ahead.
In Toronto, many of the shelters in our city are seeing like over the moon numbers of calls in and people looking for help, families, women, children. Because as you said, right, like when folks are being told to stay at home and self-isolate, if they're in a toxic situation to begin with, this kind of situation is just a recipe for more disaster in that regard. Kids Help Phone has seen a 300% increase in calls here in Toronto, or across Canada actually, and so these kinds of supports are very, very much needed. So thanks for bringing that up, Jess.
Yeah. Thank you. So I think we're going to go to Amanda, and then Zabeen, you had raised your hand earlier, and we're going to spend a few more minutes on the issues and then move on to our next topic. So keep us focused on what are the issues, what are we seeing, what are we not hearing in the media, and what are you seeing from your perspective that you can add so we're better informed.
So, and Amanda, just to introduce yourself, you're the owner of the Workaround, an incredible parent-friendly co-working space here in Toronto that I've personally reaped the benefits of, and more importantly, just a wonderful human being who I think has a unique perspective, both as a small business owner who's feeling this effect, as well as a nuanced perspective of how parents are dealing and feeling in this situation. So, would love your perspectives on this.
Yeah, so I'm not going to, I can't use my Canadian politeness on this. In my case, we're really fucked. Small businesses have been decimated, and it's not just me. I was effectively fired when the government ordered childcare centers to close. Small businesses, especially brick and mortar businesses in Toronto, many owners have personally secured the leases with their homes. I'm facing bankruptcy. I've got hundreds of thousands of dollars on the line. I have no revenue, zero. So in 7 days, I went from projecting profitability on our business a full childcare reservation calendar, full events calendar, to zero revenue. Our rent is still due. All of our bill payments are still due. So when I hear things about the government is offering credit facilities, what are credit facilities going to do to save me? I cannot take more loans on. And it's not just me. Most of the businesses that I've talked to in Toronto have lost between 80 to 100% of their revenue. They've laid off all of their staff. This issue isn't, to come to terms with how we're going to deal with this new reality. We urgently need solutions by April 1st. Or when we leave our houses, our communities, our small businesses, the restaurants, the place you go for brunch, the coffee place, the place you bring your child for daycare, they're gone. We're gone.
Yep. Thank you. A sobering point. Zabeen, we're gonna pass it to you, so please take us there, and then Julia, we're gonna go to you. Thank you. And Zabeen, take yourself off mute.
Okay, there we go. Thank you. And actually, my comment does build a little bit on Amanda's, but taking this now to the vulnerable workers. There are a couple of large groups that I think are perhaps not being talked about enough. No question, the measures that we're taking, asking people to work from home, stay home, are the right things. We need to protect people. But what we know is that the demand for so many of our services has plummeted, as we just heard. Restaurants are closed. How many of us have actually gone to a restaurant in the last week? And we are predominantly a services economy. 4 out of 5 Canadians work in the services industry. Layoffs have begun. We can expect more. And the most vulnerable workers, in particular, those who are on casual or temporary contract work, and we have about 2 million in Canada in that category. And they are the ones that don't have the supports from their employers necessarily, and they can't go to the grocery store because they don't have money to actually buy groceries. And while there are some programs that have been announced and we've taken some steps, it's not going to be enough to protect these most vulnerable workers. And they really span the entire, they're young people, but they're also people in primary working age. And the other big vulnerable segment is youth. We have students who are out there looking for work, and they are relying on this work for their tuition, for their living expenses for next year's university expenses. What are we going to do? Never mind the 500,000 or so graduates, fresh graduates that we expect this year to be entering the job market. So those are two really, really large groups where the conversation has started, but how do we accelerate that?
Yeah, thank you. And Zabeen, for context, is Executive Advisor at Deloitte for Workplace and the Workforce, former CHRO at RBC, and Chair at Civic Action. So good insight both on the corporate as well as what our society needs. I want to pass it to, I want to go to Julia Hanigsberg. So Julia, you had your hand up there. I know there's lots of hands that shut up in the last minute or so. So in the interest of moving the discussion, we will get to all of you. But Julia, I know you had your hand up for a while there. You're the CEO of Holland Bloorview Hospital. You've played a role in public policy. You've played a role as a senior executive in post-secondary. Really curious to understand your perspectives on this.
So I'm coming off rounding in the inpatient units of our hospital. So the last time I was there was around 9:30 last night. And I'm going to come back to some things that are pretty basic. And I'm going to take issue with something that Ryan said, which is that the subways and streets in Toronto are not empty. I wish they were empty, but they aren't. We are not doing what we're going to need to do to give the research the time to catch up with this virus, to give us an intervention which will reduce the death toll. We don't have the personal protective equipment that we need. That is probably the most urgent thing. I have nurses who are working overnight caring for children, and that's the question they're asking me. They're saying, is it safe? You know, can I wear a mask for this procedure? I'm worried there won't be enough when the time comes. You know, to me as a hospital CEO, the urgency is twofold. And I know you want us to get below the headlines, and I'm talking about things that are in the headlines, but I want to underline them from the perspective of someone talking to people into the night who are risking their own safety, the safety of their own children and families. If we do not do what it takes to help to flatten the curve, as we're calling it, to reduce the community transmission that is in all of our communities now, the science will not have a chance to keep up. Our healthcare professionals will not be there to care for those, you know, you and your loved ones. If those same healthcare professionals do not have the right and in sufficient quantities of personal protective equipment, they will get ill. Again, they won't be there to care for you. And those are really the most pressing issues. And somehow we have to make the seriousness of them known. We need people who have factories and industries who have the capacity to turn around what they manufacture. We're also a manufacturing country, as well as a service industry country, as Zabeen was mentioning. Turning those factories into organizations that can create personal protective equipment that we need, that's going to be crucial to making a difference now.
Thank you, Julia, and thank you for highlighting that. I mean, these are all, you know, critical issues, and just having these different perspectives is really important, so we can bring these to the surface. I want to go to I want to shift the discussion a little bit, but still stay focused in the needs and move to around what are the trade-offs that individuals are going to need to take. To your point around, you know, needing to accommodate, you know, these urgent requests, these urgent needs that company, like whether it be companies, you know, stopping their initial production and focusing on manufacturing new things, whether it be service-based businesses that are shifting their models. I want to go to Peter Faist. So you're the CEO of Staffy. Staffy is an app for hospitality industry, frontline workers. You guys recently made a pivot in your business. Wondering if you could share with the group a little bit about that, and maybe some of the trade-offs you guys are making as a company to help the situation.
Right. So we've seen an 80% reduction in our business, literally from 1 week to the next. So everything dropped off as of last Monday, which was pretty incredible. And our workforce is devastated essentially. And we've been doing surveys of calling all of our users like a sample. And most say that they're not working and they don't have any work. And so it's really frustrating, even though 96% of our workforce typically only uses our platform for supplementary income. The large majority of them aren't working right now because everything's been cut off from that standpoint. In terms of pivots that we're making, so we've changed from what was solely a company focused on hospitality and opened up our platform to all other manner of types of companies. So we're looking at working with healthcare companies, with grocery companies, with delivery, so like Amazon, Loblaws, Instacart, all those guys, to provide additional opportunities for our workforce. And you know, just as a sign of how desperate things are, we have a chef that's very, very well known in Toronto, and he came on our platform as of last Thursday, and there was a dishwashing shift available for a week, and he applied to that dishwashing shift. So, you know, to be a very well-known chef in Toronto to apply a dishwashing shift, I mean, there's something, you know, very, very alarming going on. So hopefully, as our efforts to pivot come to fruition, hopefully we'll be able to provide them some kind of work, and we're starting to see some feedback in that regard. So I am cautiously optimistic.
Yeah. So I want to focus this in on this issue of trade-offs, because as we're making decisions and there's no right decision, you're going to have to go one way or the other. Is it more debt for the country or more debt for the individuals? Is it safety for everybody and everyone stays home, or is it, small businesses not getting the business that they need to survive? What are the big trade-offs that you're seeing? And how are you navigating those? Because that's the key, is you're going to have to make decisions. You're going to have to go A or B. How are you choosing? What are the options of A or B, and how are you making that choice? I'd like, Ryan, you had your hand up for a little, so I'd like to go there. And then Janelle, we haven't heard from you, and James, I certainly know that you'll have a perspective, as many of you also will. So please raise your hand also if you want to jump in. But Ryan, let's start with you there.
Sure. So I think there's sort of at least two phases of this, and we're still in this first part of this phase, which is, I think Julia's very on direct point, is we are not at the other side of this crisis yet. We are at the phase where we're trying to make sure that the fewest number of people die and that our healthcare professionals can do that work. And so what are we going to do in this crisis moment to make sure that we can all get to the other side of this together? And I see things like the City of Toronto guaranteeing 24-hour childcare to healthcare workers yesterday, which is the kind of thing that you need to be able to do to make sure that those folks can go to work and do their job and not worry about what's at home. On our side, the trade-off is how much of our work can we let go? And as you know, our organization, we were 500 staff worldwide who support Wikipedia and its various projects. So some of the things that we've done, we told all of our staff that we were going to a 50% workload immediately, but we were going to pay 100% salary. We said that to our contractors and to our employees. We prioritized all of our internal work and said, what do we need to do to keep the lights on? But what can we push off right now to take the pressure off folks? Because of Steve's comment that people are under enormous pressure and you can't know what they need. I have a senior staff person who looks like they're showing up every day, but they've got a 5-year-old at home because they lost their childcare, and their partner works in the healthcare sector and has to go to the hospital every day for 12 to 16-hour shifts. How do I support that person? Well, the number one thing you do is, if you can do less, start doing less. You got to let go of whatever your quarterly plan was, it's gone. It's time for a different conversation. And so we've tried to do that. And I think that's important that everybody who has the privilege of taking that, who can do that, and I recognize that's not everybody, needs to think about, especially right now in this, I don't know how long it's going to last period, let's say months, to get to the other side of this crisis, starts making some very serious changes.
Let's go. Thank you, Ryan. I want to go to Janelle. So you're our youngest panelist on today. You run an organization called Helping Hands. I'm curious, from a young person's standpoint, what are the trade-offs that you're seeing in the day-to-day, and just some thoughts on the discussion so far?
Sure. So yeah, we as an organization, we actually do a lot more than that. And I think similar to Ryan, we've had to make some trade-offs. So we match students to volunteer opportunities as well as early career exploration. And very similar to what Zabeen said, is that a lot of people are really worried right now, and they only had 4 months to try to get that early career exploration. That's kind of out the window. For example, Yelp has already canceled all their internships. But even on a volunteer basis, because we are tied to the Ontario curriculum, we had to really so far only do formal volunteering. But right now we're looking at how can we encourage students to get engaged in the community through informal volunteering. And it's very difficult. Right now, also, a lot of the discussions on how you can help your community is based on donate money. And if we're talking about young people, they don't really have that capacity. So for us, there's a lot of anxiety on, if we're trying to ask students to still figure out where to volunteer and how to help the elderly, how are they doing it without them being the vectors for transmission? So for us, there's a lot of the internal anxiety. I've actually lost a lot of my staff because they were co-op students, and their schools actually pulled them. We were very rare, where we were one of the, for the 2 schools that we work with, the only nonprofit that allows students to work remotely. So even for us now, we've gotten requests being like, oh no, like our nonprofit needs to go remote. It's something we've never done. How do you do case management? So I've actually been sleeping very little over the past 2 weeks, trying to support other nonprofits and helping them. And I've even had to make a personal trade-off of we're actually, our organization's running out of money as in April. And my decision is, do I focus on fundraising or do I focus on all the response I need to do right now? So I think there's a lot of nonprofits that are being left out of the conversations. They have work to do right now, but as a nonprofit, you're always worried about your long-term sustainability and what decision do you make? Do you focus on helping people now, or do you focus on your sustainability?
Yeah. That's an important one, that's a really important trade-off. Thank you, Janelle, for teeing that up. It's do you focus on your short term or do you focus on long term? Because certainly we're going to face that from a government perspective in terms of the packages, in terms of social decisions. And then I think you also brought up an important one, which is, do I focus on me or do I help others? Right? When is it the time to address and help myself? So making sure you guys can stay on past April, or do I help others figure out how to work in this virtual world? Giving up of ourselves for others is going to be an important trade-off that we're all going to face, that we're all facing in this important time. Dan, you wanted to throw it.
I want to go to John Schell, specifically on this topic of trade-offs. Managing director at Social Capital Partners, you look both from an investment standpoint as well as a social sector standpoint, and I think just have written some pretty thoughtful articles on this topic in the last couple of weeks around the trade-offs, both from a government standpoint, what individuals are going to need to do in this new reality. Would love your thoughts on this.
I mean, I think the trade-offs that countries need to make now are very challenging, right? And countries are making very different trade-offs. So Denmark, for example, decided to freeze the economy effectively. So listening to all the conversation that's happened today, understanding what's happening in all the businesses, local small business is dead, like it's literally gone. So what Denmark did is they said, okay, we are going to provide a 75% wage subsidy to all businesses for all their employees so they can keep them. If your retail business has gone to zero, we're going to pay all your fixed costs. And then for those businesses that require debt, we're going to provide that at very low interest rates. It's going to cost them something like 13% of their GDP over the next 3 months, which is an astronomical amount of money. But at the end of that period, their economy will be at least somewhat similar to what it looks like today. That's a bold trade-off. We are, stumbling our way towards we're not sure in Canada. The U.S. is worse. So, I think there are some difficult, and these are trade-offs of deficit, right, and debt versus not having an economy to come back to in 3 months. And just to understand the severity of what that means. I mean, this will play out probably in 3 phases, and this is the nightmare scenario. This first phase where all the businesses go down, people change their shopping habits. Suddenly people are shopping online. We start a recovery. People are now buying from Amazon instead of buying from local businesses. Local businesses are slow to recover. And that goes all the way up the chain. So other businesses are slow to recover. Large financial institutions who were sitting on piles of cash before this started now see buying opportunity. And so the 3 phases of this play out to even greater wealth inequality when we come out of this on the other end, unless we figure out a way to shift how we do things. So there's trade-offs now in terms of how much money we're willing to spend to freeze the economy. And there's going to be trade-offs later in terms of what we allow to happen coming out of this. Coming out of the financial crisis, we allowed massive wealth inequality to occur. We are on a path to doing the same thing again. Those are the types of kind of higher level trade-offs that we're going to need to figure out.
Thank you. Thank you. Amanda, you had your hand up, and then Duncan.
Yeah, so my point is, for us just to not to forget the trade-off of parenting and home life and work life in the same space. We're dealing with a ton of stress and anxiety, and where our employers are asking us to work from home, we're trying to do that while taking care of small children and not to set up. We know that children can feed off of their emotional energy, our emotional energy. And so when we are jacked up and stressed, we know our kids feel that. So, I got to stress to all of us that are watching, if your kids are at home, abandon the rainbow schedules and the beautiful online learning and homeschooling, and just survive, because it's brutal. It's brutal right now. And we haven't we have not at all addressed how we are going to continue in this workforce while raising tiny humans.
Yeah, good trade-off. Rainbow and online education, or just survive. You're going for survive. I think that's valid. Duncan, you had your hand up for a while. Please share your thoughts.
And Duncan, I'd love also just as a quick thing, what are the trade-offs you're seeing in the hospital itself? I'm curious on that. And then the other question that you had, if that wasn't it.
So the trade-off in the hospital is we have to make short-term pain for the long-term gain. We have to conserve personal protective equipment. We have to conserve resources, because we know from what's happened in Italy and other countries, a tidal wave is coming. We have to accept a little bit more risk now to mitigate the risk that's coming. But I wanted to reiterate what John was saying. So the role of government is to do for people what they can't do for themselves. So if you're unemployed and you have no savings, you cannot feed your family, you cannot look after yourself. So we will have to accept a significant debt load as a nation. And we need to accept now what we should have accepted 25 years ago. And this applies around the world: higher taxation, minimum national income. We have to accept the fact that we should incentivize virtue instead of incentivizing profit, so that the largest corporations that are incentivized to go after one thing, which is greater and greater profit, which contributes to more and more economic inequality, they need to incentivize the good of our society and the good of their workers and the good of their suppliers. And yes, as a nation, we're going to take on massive quantities of debt. And unfortunately, if you don't do it now, you will do it later, and it'll be more painful.
Yeah. Thank you, Duncan. James, can you, I know you have to leave shortly, and no better segue over to you. Duncan saying, let's take on more debt because we have to incentivize virtue. You deal in debt all the time at Moody's. This is your credit risk, director of credit risk analysis. What's your take on this trade-off, and any closing remarks, particularly take us to solutions that you're seeing?
Yeah, sure. So, I mean, an important trade-off when taking on more debt is to remember that, the people that are paying for that debt are the next generation, right? So to say that we should go up to, 15% of GDP as a package to help out people that are alive right now is all well and good. And I could think of a number maybe that's smaller than that makes a lot of sense, right? Who knows what that number is, but I agree with the idea of spending more now. But just keep in mind that it's not costless, right? There are people that pay that price down the line, Another thing is the nature of work has changed. And so we have a lot of people moving to be less tied to a single employer. They work in a gig economy type job. And that's great for flexibility. It's great. You get to do your own thing. You get to have a lot of choice in the work that you actually do. But the trade-off there is that you don't have a larger organization that to some extent has your best interests at heart. It has your back, that is now protecting you during these kind of periods. So I think it was Ryan that was saying his organization was able to allow all of their employees to go to 50% capacity. That is only available if you are part of a large group, right? So just like governments come together and help all their citizens in times like this, well-run corporations, that do have virtuous intent, are able to protect their employees as well, right?
Thank you.
Thank you, James.
Thanks, James.
I want to, and I think it's a really interesting point you mentioned around the larger organization. I want to go to Harry Mosley. Harry, you're the Chief Information Officer of Zoom. I mean, of any company in the world that comes to top, I feel like the growth that you guys have seen probably in the last week, and also just the number of insights that you would have around people moving virtually and understanding the nuances of those trade-offs. Really interested to hear your thoughts on this so far.
Yeah, thank you. So first off, I'm not a financial or a medical expert, so I can't offer any opinions in those regards. And agree on all the points that have been shared so far. The layoffs, the inequality are rather dramatic, and they're happening everywhere all around us, 360. I mean, pick an industry. On the other hand, I do see a lot of creativity going on out there. I see, whether it's like the local restaurants as an example in the village where a friend of mine lives, banding together to say, okay, you know, we had a big dining operation which just went up in smoke, and we're not structured for doing, you know, delivery. So they got together and they've created a subscription so that people who live in their village can subscribe to the restaurants, and they're delivering meals 4 nights a week, which is great for, you know, an elderly person, right? And you get a bit of variety, you get a bit of balance to the diet. So I see a lot of creativity. I see a lot of sort of people who are, and we talked about some of those trade-offs and some of those pivots before. I see things happening like that. You know, on one hand, it's like it's great to read about Amazon hiring 100,000 to 150,000 people, but I think, I'm not sure who spoke about it, you know, sort of what comes out of the back end when we get over this, you know, sort of the rich got richer, the big companies got bigger, and then and all the small stores have disappeared. And I think it's really incumbent upon us to try and support them as best we can in their time, so that when we do get past it, it changes. The thing that I worry about most, quite honestly, is the mental health of people. You know, it's you know, I was on a Zoom meeting with the Dublin Jewish community recently, and you know, sort of seeing elderly people who are living alone, not being able to see their children, not being able to see their grandchildren, not being able to see their friends, not being able to go get their hair done, not being able to go get, it's like they can't do anything. And so that I'm very, very worried about that lonesomeness. And so, you know, from a Zoom perspective, yes, you know, we're trying to do our bit. You know, I think everybody's probably read about the K, you know, what we're doing from a K through 12 perspective. But then there's a lot of creativity going on, whether it's birthdays or weddings or, you know, sort of all sorts of events. There's, you know, a friend of mine pinged me yesterday morning about how his church is having, you know, doing services over Zoom with families being gathered in their homes. So there's a lot of creativity going on, but it's also a time I fundamentally believe that you can pivot to making great memories. Yesterday, my wife and I were out walking, and it was great to see mom and dads with their kids out biking or, you know, sort of having fun together. And I think sort of it's hard. It's like listening to Amanda's story about how her business went, you know, literally to zero overnight, and there's a lot of those. I think that it's, you know, you're going to have to be strong and try to focus on sort of what are the elements of good that we can garner out of this. I think it's also a time when, quite honestly, a lot of people are reflecting on sort of their lives and what they've been doing. And my last point is that when we do come out of this, which is inevitable, it's just we don't know when that will be. I think things that there's going to be a lot of things that have changed forever. It's kind of, I look at this like what we experienced here in New York when we went through 9/11. Things change forever after 9/11. And I think after coronavirus is gone, I think things will have changed forever, and it's going to be a long road to recovery.
Agreed. Thank you, Harry. That it is. We've got a lot more ahead of us. Kevin, you've had your hand up. What are you seeing the big trade-offs? What's your reaction to what's been said so far? Where's yours going?
Yeah, I just think from a marketing communication perspective, I think a lot of companies, especially the larger organizations, are going to have to figure out whether they circle the wagons and protect business, or they open up and take on a little bit of that or part of that responsibility, not only back to their customers, consumers, but also to some of the smaller businesses that Amanda referenced to. And we've seen that happen around the world already with some really great organizations standing up for purpose and helping out people on the ground, and then kind of being able to sacrifice or turn away for the moment on profits, on selling products, and helping out their fellow men.
Yeah,
completely agree with Kevin. Helping people right now is got to be objective number one. I mean, waking up and thinking about how can I help people.
But look, I think let's be clear here. We have a number of brands across the world, large and small, across many categories. Some have been devastated by this. You think about tourism, you think about automotive, like those categories are getting hit. There's some categories, like CPG and food and others that are kind of holding flat because those are basic necessities. And so companies are having real-time issues around delivering profits and how much they begin to point and start looking towards purpose, which is the people.
So I want to thank you, Kevin. I want to jump. So right now we're also obviously broadcasting live on Facebook, and we have individuals who are sharing questions and thoughts for panelists as well. A couple questions that have come in. Are there good ideas from economists on how to organize the future economy while following this crisis?
So can I just, I'm going to jump in?
Yeah, sure.
That actually transitioned us to where we want to go, which is the final segment of this, which is solutions. So we've highlighted the main issues, we've understood the trade-offs, and now it's okay. I'll take a little bit of a cue from Harry as you're saying, how do we make this a positive thing? How do we come out of this? And this is a tough time for all of us. Amanda, you hit it home for us, and Anil. So what are the solutions? And we'll come back, and then let's specifically get into this question, which is, are there good ideas on how to organize the future of the economy following this crisis? John, I imagine you'll probably be the best one to help us. And then Karen, we have yet to hear from you. So we're gonna put you on the spot after this, and I wanna hear what are our workplace solutions that we're gonna need. But first, John, talk to us about how do we structure the economy?
I mean, look, I'm not an economist, so I'm playing the role of an economist on this as Zoom chat. But I mean, look, so first of all, I think there's a real danger in spending too much time celebrating little positive things. Media looks for balance, right? And so in balance, they're like, this thing is terrible, but hey, someone helped someone walk across the street yesterday, and wasn't that nice, even though they did it from 6 feet away. And I just, the seriousness of this for so many people is so dramatic that any effort to describe this as some kind of resilience, a moment of positivity, I think is a massive mistake. We need to understand the seriousness of this and the people whose lives are going to be permanently affected. I think there's going to be some real question about globalization when this thing is done, and whether or not it's helped us. Right, whether or not we have all jumped on the neoliberal bandwagon of more trade is good and more connectivity is good, and I think there's going to be some question for some people about this. I think in terms of ideas and structuring the economy, I mean, look, this is going to be about what do we think about trade and what do we think about taxes, and I think the problem, so let's take it from a Canadian perspective, okay? So we actually have very little sovereignty over our taxes, right? We have a free trade agreement with the US, which links our capital systems, meaning that if you said in Canada, we are now going to increase the tax rate on the highest, on the top 1%, you'd see a massive capital flow out of the country. So the question out of this will be, are we willing as a group of nations to get together on the key taxation policies, like what's the corporate tax rate going to be? How are we going to treat private equity profits? How do we think about the highest tax rate in our countries, and the coordination of that across countries? Otherwise, we'll have a whole pile of Ireland situations where someone says, you know what, I'd like to boost my economy. And to boost my economy, I'm going to reduce corporate tax to zero and pay $1 billion so that Apple comes here instead of wherever they are today. And then we get into this cycle of countries competing against each other in a globalized economy until everyone has to race to the bottom on their taxes. So yes, the good ideas coming out of this is it's not international cooperation can no longer be about how do we get my cheap wine to your country so that I can get your cheap bicycles. It has to be about how do we organize our tax systems and social safety nets in a equal way across countries so that there's no longer incentive to play us against each other in order to create profits that are, unsustainable and only due to tax competition.
The more I think that's an incredible solution that I'm hearing, which is going to be a big one. But COVID-19 has certainly showed us that we are truly one globe, and anything that happens in one place affects us all, and the importance of coordination and collaboration. You brought up a good argument for why we need to have better economic coordination. Thank you, John. Karen, what are you seeing? What are our solutions for the workplace?
Well, I think there's we've touched on a number of the topics that certainly I'm speaking with people about. I would just like to zone a little bit on this conversation around leadership and a massive amount of narrative that we see about C-suite executives and how they need to build, whether it's build resiliency, lead from the top. There is a segment of leaders, though, I think in many larger and mid-small organizations that we're not really talking about right now, and that is middle management. That's where people get anchored in their businesses. It's where they get the direction from. It's probably the segment of the workforce that I think is under the most stress, probably experiencing the most anxiety mid-career, small children, teenage children at home potentially. And so I think that, some of our solutions need to be focused on how do we actually build capability and capacity in those leaders, because I think that's where people feel their true north, right? That's their North Star in terms of how they feel they can be best supported within their businesses and their organizations they're part of. So not enough conversation in my mind around how we support those folks.
Thank you, Karen. And I want to go to, I think, Neil, you had your hand up. And then Amanda. Yeah. So Neil, keeping in line with this idea of solutions, recognizing that, it goes beyond about just walking someone across the street, but at the same time, when we think about ourselves as citizens, if we're not in the position of structuring economic policy, what are the things that, we can every day can do that has a meaningful impact on our community? And I think as Toronto Foundation, you're seeing some interesting things that maybe you'd like to share.
For sure. Thank you. So I definitely, I'm not going to comment on a lot of the things on the economic side, but a couple of things I do want to focus in on is when we think about the needs in our communities, right now, absolutely 100%, food banks are really, really feeling it, and they are opening their doors to more and more people that have never used a food bank before in their lives, and so that is absolutely a place of need. I mentioned shelters earlier. I mentioned Kids Help Phone. Mental health wait lists in general are just are already in our city skyrocketing, and that need is continuing to increase. I want to also highlight in a city like Toronto, where we have the largest urban in Canada, or the fastest growing. I think it's communities like this that typically get ignored by and a lot of funders, and in a time like now would really be ignored completely. And I think it's important to highlight that there are absolutely needs in communities like this that provide wraparound services, that provide cultural awareness, et cetera. And they bring communities together. And when they are not supported at times like this is when they start to really fall. And as a result, all the people depending on them really, their needs are not met. And so that's something that is really important. I want to highlight a couple solutions that I'm aware of, that I've gotten involved in as well. One is just a very grassroots initiative that started here in Toronto called the Friendly Neighbor Hotline, and it was put on by the team over at UHN Open Labs. And what they've basically done is mobilized a group of close to 350 volunteers now that are basically what we're going to be doing is we're going to be going and picking up supplies for seniors that live in community housing in the city, and we'll drop them off. They will pay us, and then we'll provide those needs. And so these necessities for people that just can't get out of their homes, can't get out of their apartments, stuff like this is really important to do for those that can. There are a number of initiatives underway around. Julia was talking about the personal protective equipment, and there's a number of guerrilla style or initiatives and grassroots initiatives that are coming up where people are trying to find ways to procure these elements. And one of the ones I just wanted to highlight was it's called the Homefront, homefront.ca or Homefront.ca. It's in partnership with Shopify. This is launching later today. Kevin, I really want to talk to you about this, because I think the brands you represent, there are opportunities here to see how the media and sort of communications can get behind stories like this and share them more broadly, because I think this is the way that more people can hear about these opportunities to really come together and find ways to make change.
I apologize, Kevin, we're going to go straight to you, but before we do, I want to just, Harry, you have your hand up. I know you have to leave in just a moment. So can you give us your one solution on what's your call to action? Everyone listening today, we've got hundreds of folks listening on Facebook, and it'll be recorded and shared out to live. What's your one call to action of what somebody can do to help in this time?
I wish I was smart enough to have the one solution that I think everybody should do. I'm not. I do think that, sort of waking up and seeing how you can help somebody, however small it is, however small it is, I think that collectively, a lot of small things end up being a big thing. So I think that there's no small act should be done. I think that you should, wherever you can help somebody, you should, and whether that's taking an elderly's pet for a walk, etc. I think that there's no whatever you can do to help somebody, I think, is a good thing, and those things tend to sort of flourish and self-populate. So I'm a little bit different in my opinion on this from what John was saying. I do think it's huge. I mean, it's massive. The scale is enormous. And so small things are not going, we need big actions by big organizations and big governments to be able to make some pivotal changes. But when it comes to the average human, helping your neighbor, helping somebody is critical. Just wanted to say thank you to Boma for hosting this morning. It was really quite moving to hear the various different stories firsthand. And so for those that are helping to sort of overcome this, thank you for everything you're doing.
And thank you to Zoom too, Harry. We really appreciate your guys' partnership in this broadcast, and look forward to collaborating in the future.
Absolutely. Anything we can do to help. Yeah. Thank you all. Bye-bye.
Thanks.
Have a
Be
great
well.
day. Yeah. Let's hope
Harry.
that everybody should stay healthy, please. Okay.
Thank you, Harry. Yes, and same to you. Kevin, take us up where we left off. The brands, they presumably are the ones that have a lot of money, more money than everybody else. What should they be doing? They talk a lot about purpose leading up to now. Now it's where you can put your money, where your mouth is a little. What's your response to Neil?
Well, look, I think that it's the whole question around the balance between purpose versus performance. To kind of sum it up, right, is brands now are going to start pivoting and have to start pivoting away from some of these, performance, how many products or services can I get through, to leaning more towards purpose and how are people going to think about me after we get out of this as a brand. And I think that is going to be critically important to how we move forward. Go ahead.
Are there some examples you've seen of brands really stepping up that you think are worth showcasing?
I think there are many. I'm seeing a lot of organizations coming together and creating mental health forums. I'm seeing organizations banding together, banding their people together, and as Anil mentioned, getting out into the communities to help seniors. Like, I think that there are a lot of brands out and organizations out there QBing some of the work that you're seeing in the communities as well. And I think kind of living out what they need to do individually. The only other point that I would make here is just in terms of solutions is,
thank you.
My goodness, can we avoid some of the siloism that we're seeing right now? Can we please get the education industry to speak to the business industry, to speak to the mental health industry, and get those three bodies together, because independently they're going to fail. They have to band up and figure out if my staff and my talent are a great place mentally, and then marry that up with the fact of getting them into virtual classrooms like Zoom, and then marrying that up with productivity, we could make our lives a whole lot easier. And right now, it's not. I love my son, but I don't necessarily want him pressed up his lips against the glass pane as I'm doing this speaking forum right now. So we just got to get those three groups of people married up.
Thank you, Kevin. I think it's a great point. I want to go to Steve. You've had your hand up, and then we had John Shell. You had your hand up.
And actually, we're going to make a full round. We've got 12 more minutes, and we want to hear from everybody. What's your one solution? What is the action we all need to take? Steve, go ahead.
Yeah, I just wanted to talk about the solution issue from a slightly different perspective to get people thinking about it. First of all, solutions, I don't like that word, because I mean, that you're going to solve this. We're not going to solve it. We're going to try to fight back. So, anything we can do to keep the fight engaged is very critical, because the line between anxiety, which is what we all feel now, and depression, you can kind of describe those as anxiety is your body saying, do something, do something. Depression is your body saying, there's nothing you can do that matters. Stop trying. And if we go from anxiety to depression, if we have mass depression, then we really have a big problem. So we have to honor that do something, and we have to feel, and I see, a child here, we have to really project to our children that we are doing something. Staying at home isn't hiding away. It's not anything like that. It's our best attempt to help the people in our community that need it the most. And those are our healthcare professionals, and those are obviously our elderly and the people with compromised health conditions. So we have to come up with levers of control, and whether it's businesses suggesting, here's how we're going to try to make life better after, or whether it's individuals or companies like Zoom that are connecting up various people to have social online meetings, we have to find things we can do that will make a positive impact. Solutions, wow, that's high in the sky, but a positive impact is very important to our mental states right now.
Thank you, Stephen. I think actually it's do something. My therapist always said to me, anxiety is your best friend. It's telling you something. It's telling you something's wrong and you have to act. And I think that's what I'm hearing from you, which is cue into the feelings you're having, and let that push you and be your energy to just act, because that is then how we continue to go, because the alternative is not as positive. Amanda, can we? You're on mute, and
yeah.
What's our solution here? And thank you for
or what's something positive we can do in this situation?
You're not going to get positivity from me.
No, that's what I was going to say. I don't think
you're not going to get anything positive from me, because it's with all respect to the panelists, this is urgent for us, and it's frustrating for me because I'm sitting here thinking and screaming inside, we don't have time. We don't have time. Small businesses do not have time. I'll tell you what the solutions are not. The solutions are not credit facilities, and they are not debt. For a business like mine that already has hundreds of thousands of dollars in loans, with leases that are personally secured, with zero revenue projected and no idea when this is going to end, I mean, I don't have an MBA. I have a marketing background. I used to work in nonprofit, so somebody else can explain this to me, but it makes no sense to me why the solutions coming out of the government are talk to Business Development Canada about a credit facility. How can I take on a credit facility? It is absolutely the most important thing that I need right now. I need all of these panelists to use the professional, the influence and power that you have to talk to all orders of government, your city councilors, your MPs and your MPPs, and get rent relief right now. We need expenses to drop to zero. We need rent relief. 10% subsidy, I'm sorry for wages, ain't gonna cut it because I can't maintain 90% of my subsidies right now. We need cash in the form of non-repayable grants, and we need expenses to zero tomorrow, or I'm done. And by done, I mean bankrupt.
Yeah. Thank you. That is highly important because that is the reality. And without this voice, we don't know and truly understand it. And we hear you. And I think there's good examples of countries doing that around the world where they have literally just said, here is cash. And that's how you address the short term to the trade-offs that we've been talking about. Peter, please, what's your viewpoint on solutions? And then we're going to go to Julia and keep going.
Yeah, I have to agree with Amanda that the solutions proposed by the Canadian government so far have been woefully inadequate. They're asking BDCs they're asking us to get loans through BDC and then personally sign for those loans, and they want to do credit checks and all that kind of thing. And the small and medium-sized businesses, the companies that need it most, the types of companies that need it most, don't really have good credit. Don't have formal accounting books published by like a big accounting firm and that kind of thing. And those are the base requirements of getting a loan from the BDC through this program. So I totally understand Amanda's frustration, and I share it. And I know that many in the restaurant industry and the hospitality industry share the same, because they're operating on razor thin margins, and they've got all these expenses coming up, and their revenue has literally gone to zero almost overnight. You know what I mean? So it's really, really frustrating, and I think there needs to be a dramatic change in what the government is proposing. Solutions, again, I mean, I don't just as much as the other people. I don't know what the solution is, but I think it's going to have a cataclysmic effect on the economy, and we need to really. I think the only solution in my mind is to lobby the government to introduce these changes that can, or these funding, vehicles that can really help small and medium-sized business. Because if we don't save them, there won't be anything to go back to.
Thank you. Julia, you just went off video. Are you still with us?
I am. Sorry, that was unintentional. Here I am, back, I think.
There we go. Thank
okay.
You. What's your view? What are the solutions? Give us your direction on what we can all be doing, and also what are you doing to give us the example of how we can follow?
So maybe three things. One, to build on Amanda's point, and this is less from my healthcare CEO perspective than my viewpoint from post-secondary from a number of years ago now. For a while now, I'd say a better part of a decade, our government has really been promoting entrepreneurship as the way forward in our economy. And this is where the rubber hits the road on that in terms of government's willingness to support entrepreneurs in the hard times. And I think Amanda makes the point so clearly that the flip side of that support is you have to come in and create the safety net for entrepreneurs who have taken up the call that government has put out there over the past decade. So that's the first point. The second point, and it's one that I'm sure Anil will speak to, and is that for many of us, an organization on my side, we're a $100 million organization, but for billion-dollar organizations and tiny community organizations, many of us depend on fundraising to actually do the work that we do. Despite the fact that we're a public hospital, only about 2/3 of our funding comes from government. We are, in the current environment, taking enormous financial risks because it's the right thing to do. So we're spending where we need to. We're sending staff home and we're paying them all. Where they can't be in the building, we're paying them anyway. And we're spending in all sorts of ways that I won't bore you with. And so from at every level of organization that's highly dependent on donor dollars, we need to make sure that those who continue to have deep pockets, even though your pockets will be less deep with the way the stock markets are trending, we still need those dollars to flow. As we come out the other end of this, which we will eventually, those who are our most vulnerable will continue to be harmed. The social determinants of health, things like poverty, postal code, ethnicity, refugee status, indigeneity are going to continue to be the things that are going to put people most at risk. And we're going to need our social safety net, including the private wealth that exists in our country and will still exist, even with the challenges of our economy, to step up and play a role. So that's my call to action across the board. And then my final one, I started with it, I'm going to say it again, it's super tedious. Please, please, people. Please, please stay home.
Perfect. Thank you, Julia. And just because we don't want to lose that, it is for effect. Please stay home. It just impacts the rest of us. And actually, for context, Dan and I happen to live together. We're partners in life and in business, so we are following the rule, but we happen to already be here. Sabeen, you had your hand up, and I'm going to ask it everybody now. I want to get to everyone, and so if you can keep your thoughts. What's next? What are the solutions? How do we move forward? Please keep your comments quick so that we can hear from everyone. Go ahead, please, Zabeen.
Thank you. So I want to talk a little bit about being hopeful. I completely get the gravity of the situation. We need to focus on the big issues, the now issues. But from a workplace point of view, there are three things I'm hopeful about. One is, are we actually seeing a slightly gentler business tone emerge and this better balance between purpose and performance? And there are certainly good examples there, because it is performance with purpose that we want to get to. The second one is around remote work. This is the biggest social and business experiment we've done in ever. And we've gone from from concept and idea to execution within hours or days. And there are things that we will be able to learn from here in terms of business, access to talent, but also in terms of inclusion. There are many people who will be able to have better access to work ultimately in rural communities, people with disabilities, parents that are juggling childcare, adult children juggling elder care. So how do we actually take advantage of this and learn? And the third one is around mental health. Organizations have been moving in that direction in terms of really mainstreaming mental health and mental health support. We've seen good progress. This, for me, has to be the inflection point for the future. And how do we actually build that as a core component of not just programs, but organizational culture that really is supportive of people's mental health? So I want to end with those hopeful, and what I hope when we come out of this, we have ways to really turbocharge those three elements.
I couldn't agree more. I think this is a perfect time to question the status quo and consider whether we return to what we had before, or can we leapfrog and go to the next. Steve, I think you were banging the table, if I'm not mistaken. Anything to add to that?
I don't think I was banging the table, but
oh, somebody was. I thought
that's okay. But that's okay. No, I do think, and thank you. I'm going to be mounting a course on Coursera that's going to be free to everybody. That will be mental hygiene, how to literally mentally stay intact during this time, and showing some of the ways you can control anxiety. In fact, turn it off for periods of time. So things like that. So I just want to mention that by the end of the week, hopefully on Coursera, that will be available. I do agree that we now have to kind of start thinking of mental health like physical health, where we take care of ourselves physically so that we can meet the challenges we're going to have some tough challenges coming. This is a hard hit, and it's probably not the last one. So yeah, we're going to have to become mentally a lot more resilient and able to control how we emotionally react to things like this.
Perfect.
Thank you, Steve.
Thank you, Steve.
Let's jump. We had John, then Ryan, then Duncan.
So, look, I think, absolutely everyone should be helping others, and I think we're seeing that. So what I said before wasn't to say don't help anyone, only stress out. Sure, anyone who can should be helping, and I think we're all trying. I think, though, if we, and so I'm going to disagree with Zabeen here. I think if we are hopeful that coming out of this, what will happen is businesses will choose on their own to add more purpose and remove profit, we are kidding ourselves. There are incentives in society that has led us to where we are today. Those incentives are not going to disappear on their own. And there is absolutely no chance that businesses will voluntarily choose to change. They just won't. They never have. So the question is, coming out of this, what will we do, right? How will we as a society think about how we should be organized and what that means for all of us? And so I guess if I can be hopeful, it'd be that the collective sort of feeling and the view, I think, of many people that right now we need to dig in and help everyone continues to exist afterwards. And so that we as society take back the agenda and ensure that we are organized in a way that is beneficial for all of the people that need to be helped. And frankly, Julia, what a wonderful summation before of what the issues are and what needs to be done. So thank you to everyone.
Thank you. Thank you, John.
Thank you, John.
And Julia had to leave. And I know many of you do, and because we're going to also shortly shift to another segment. So if you do need to drop off, we thank you all. But let's continue on the solutions. I want to hear from everyone.
So we had, just in order here, we had Ryan, Duncan, I had Anil, you had your hand up, Peter, then Kevin. Those are just in terms of going.
And Janelle.
And then Janelle, yeah. So Ryan, please.
Sure, I'll be quick. Three quick things. First of all, normal is gone, and the new normal is not coming for a while. If you're looking for a thing to look to as a parallel in history, it's the war. This is a war effort, and the kinds of things we're talking about, massive government intervention, repurposing of industries in order to respond to crisis, that's your parallel. And so think about the ways you have to respond in that environment to get to the other side, to get to the new economy that will emerge later, and it will look nothing like the one that we're used to. Two, take care of yourselves. And I really think, Steve, I'm looking forward to your course, but really take care of yourselves. There's this podcast I love that my wife introduced me to called the Feminist Survival Project 2020. Episode 1 is about separating your stress from your stressor, which is to say, you can't fix the thing that's stressing you out because it's a pandemic, but you can relieve your stress in order to hold yourself together, and learning that skill will help you get through this. And episode 1 talks about that. So go find it, go listen to it. Third, take care of each other. If you have capacity as a person or as an organization or as a company to give. If you can release others from their responsibilities, do that in every way that you can so that they have capacity to give to people in their world who don't have that capacity because they're doing other things when they're required to respond in this war effort. If you have money, give it. And if you have influence, use it to make sure that people are stepping up and responding to this in the right way, to stay home, to take care of each other, or to release others so that they can take care of each other.
I think that's really well put, Ryan. Thank you. Duncan.
So I agree with that, but I have to say, and I hate to say it, there is no solution to this. Healthcare and the healthcare challenges that we face are fundamentally infinite problems, and there are strategies. And I think one of the key strategies is physical distancing. And I think we should change the terminology, because social distancing is fundamentally wrong. We need social closeness, but physical distancing. So we have technology, we have so many ways of communicating with each other and maintaining that closeness. We just don't need to do it in person where we can harm each other. And going on to a longer term strategy, It's easy to blame government and blame business and to blame everyone except ourselves for what is fundamentally happening in our society, which is a clear focus on profit instead of a focus on virtue. So we are business, we are government. If we want the cheapest possible toaster at our local store, then business and government will evolve to give us what we want. We have to change what we want. We have to understand that we have to make do with a little bit less and pay a little bit more so that we have local manufacturing capacity, so that people in our community have jobs, so that there's a focus on virtue, so that this planet will be sustainable, because what has happened is just a reflection of what is to come. We will have more pandemics, and we have issues like climate change that will destroy the planet. So I think it's time for all of us to wake up and show business and show government what we want, and they will evolve.
Yeah. Thank you, Duncan. And I think you reflect what Zabeen is bringing forward, and the big challenge is, as John is saying, is, well, what do you do? How do you shift? Because it's one thing to say it, and it's another thing to actually see the change. I just want to go, Peter, I know you've had your hand up, and then Kevin. And I'll just put it out here also that we got a question in from Facebook, which is, a lot of people believe the true leadership capacity of a person is tested during these times of crisis. As leaders, what is one thing you should always keep in mind when running a business and running a business or an organization in crisis? Peter and Kevin, you are both CEOs. So please, to the degree you want to and can answer that question, please add, and then please continue to offer the solution that you had originally had in mind.
Right. So first, I'd like to say that I'm also very much looking forward to Steve's course about mental health, because that's always a huge issue, and I'm starting to feel anxious. I started quarantining, or not quarantining, but self-isolating as of last Tuesday. So it's been quite a while now that I've been in social isolation, so to speak. So I'm starting to get a little anxious, a little antsy, and walking in the street is not really practicing social activities, but I'm trying to find new ways to do that every day safely. In terms of, the question from Facebook, and what CEOs can do is unrelenting effort to change and affect people's lives in a positive way. And that's really what I'm focusing on. Is I'm not stopping until I get a solution for the 30,000 workers that we have on our platform. So I'm emailing every CEO, every company that I can think of to try and get help and what we need. And I think what the general population needs in general is for CEOs of large corporations to step up and make efforts to help their communities in whatever way they can.
I think,
and then there was one more question. Sorry that I forgot. Anyway, you got it.
You got it, which is help. I think, and that's the question, which is, what's in your power. Kevin, you were about to say something.
Yeah, look, I think from a CEO perspective, I'm taking a very pragmatic approach, which is this is my opportunity to serve. And as a CEO, I think that's always the opportunity and the responsibility from a CEO is to serve, but even more now. And I'm reaching out to the individuals to make sure, on an individual level, to make sure they're okay, how they're feeling, how can I help. Our group got together and there was over 100 people on Zoom on Friday having a virtual drink. And there we were from 3 different markets laughing and talking. And I told them that I really missed them, because I did. And I can't tell you how many responses I got back about how fun that was and how much we really needed it. And I think that we, as leaders, have to remember that is, how do we keep that connectivity, recognizing that we're all in different areas, and anything that we can do to make life more normal as will benefit us all. And in this case, I'm just like them. I'm in the same situation as the team that I serve.
Yeah. Thank you, Kevin. Anil and Janelle, and then at the same time, I'm going to actually also start to bring in a few other folks that have very particular solutions that they want to share with us. So Anil and Janelle, going to throw to you to kind of close us off on solutions on your view, and then introduce the others.
Perfect. So for me, I just want to reiterate, we need Canadians with resources to give more now than ever before, especially to the most vulnerable. The next few months we're going to continue to see unprecedented challenges. And I think, so I represent the Community Foundation here in Toronto. We're doing something called the Better Toronto Coalition. You can look that up online. There's other community foundations in Seattle, Boston, Vancouver that are stepping up with responses as well for local community to try to highlight and focus attention and understanding into these areas that are most needed. It's this real notion of really trying to educate people about the needs at play, and then really empowering them to find these organizations and give directly to them. Julia summed it up really well earlier in terms of the areas that would have particular need. And the last thing I just really want to touch on is this notion of, I've been in conversations with friends, colleagues, advisors, et cetera, and people talking about, dollar cost averaging, and now's a great time to sort of invest even more into the market and kind of build out your portfolios and all this stuff. And I just really want to implore people to think that if you have the capability to do something like that right now, really think about that choice, and really think about the trade-off of that choice and what you could be doing and how you could be investing those dollars in the community in such a more important way for people that need it right now. And so that's a real just sort of, I'm imploring Canadians and globally citizens to really think about these kinds of ways to be investing and really just reframe that sort of word of investment, and that investment in our community is really the investment that's most needed right now.
Thank you. Here, as John said in the comments. Janelle, and then we're going to turn it over to Zara, who just joined us to share what solutions she has in place. So Janelle, please.
Thinking that this is a global event, and we're talking about from a Canadian perspective, I think a really cool word that's come up here is caremongering. It's instead of scaremongering, it's how could we come together and care for each other. I've seen amazing things happen. We're actually transitioning our app right now to solely focus on how do you get person to person helping each other out. So that's something you guys can check out at helpinhandsapp.com. I think we really need to focus on unintended consequences. If care workers aren't able to go and visit children, what could be the rise of child abuse? So I think we really need to focus on how can we support organizations who are doing the work that can't wait, that cannot. And I think Anil said a lot of those same points, is really making sure we have unrestricted funds, ensuring that we're giving the nonprofits money and letting them trust that they know what they are doing with this funds. I think people need to also make personal sacrifices. I have student loans I still need to pay off, but I've made the decision that with only about 4 or 5 week runway, I'm stopping basing my salary to ensure that my 2 employees who are also students, that they have at least as much money as I can possibly give them from what I have for our runway. So I think if I'm able with less privilege than some people I'm around, that I'm able to make that sacrifice, that those with a lot of privilege are able to make really drastic sacrifices to ensure that everyone else around them can continue on.
Thank you, Janelle. Appreciate your input on that. Zara, let's hop over to you now. So you've been a city builder ever since I've known you. You headed up Dublin, and now you're running a number of great civic initiatives, social innovation initiatives. Tell us a little bit about the app that you built and so what you guys are working on.
Can't believe in the time of COVID, I'm talking about an app, especially being as analog as I am. Well, thanks for having me and talking about this. Really simply, it started as a spreadsheet on Tuesday, where because of the position that I play in the city, where I'm sort of between institutions and grassroots communities, people were sending me things. And I was feeling a lot of responsibility to put out these amazing things that I was hearing that I didn't necessarily have use for, but I know that the communities that I work in service of definitely do. So started compiling an online resource. Within a couple days, I posted the spreadsheet on Twitter. We had close to 30 collaborators actively finding resources and popping it into the Google spreadsheet. 2.5 days later, an ER doctor who's on quarantine because he came home from a family holiday knew how to put it into a software that basically takes a Google spreadsheet and creates a web-based app, which is something I just learned. I don't know much about apps, but a web-based app that live feeds from the Google spreadsheet into a more user-friendly interface. And so we launched it on Friday, and every morning I check, we have about at least 2,500 users actively using it at any given moment. Compiling resources for those who want to give. So the kinds of things Anil was talking about, the kinds of things Janelle was talking about. For those who are in needs of support. So everything from, I need groceries delivered, I need someone to talk to, I need mental health supports, I need $100 right now. And then free activities that are available online. So that's a sort of a range of everything from sort of fitness to educational to arts and culture activities. We've got some other stuff, but those are sort of the three core.
So where can people find this, Zara?
It's covidto.glideapp.io. And if you follow me, Zara EB, on Twitter, it's impossible to miss.
And we'll also share it on our Facebook as well, and a number of other resources. There's also savesmallbusiness.ca, which John, I know you shared, and a number of other things that we'll be sharing following this broadcast for all of you watching at home if you want to be able to contribute, as well as the Toronto Coalition that Anil mentioned and others. Just in the interest of time, I want to jump to our next solution-oriented approach, Ricky Mera. So Ricky, you've been you've been an investor in the healthcare medical space for some time, and you've really stepped up in the last few weeks to help on the frontline situation. Curious if you could just share with the group a little bit more of some of the efforts that you've been working on.
Yeah, thanks Dan and Jess for organizing this, and hello everyone else. Yeah, it's been a tumultuous week. I haven't slept much. There was a time in my life where I would take on Asia and Europe and North America hours, but that was a couple years ago. At the current moment, I am trying to marry government needs, so command centers that have been set up at the provincial level with suppliers that I'm trying my best to vet as being tier 1 suppliers in Asia. There is a surplus of PPEs and ventilators that are sitting in various regions in Asia, especially in China right now. But everything is changing by the minute. There's a global demand to pick up these things. And I've had some challenges identifying the right people on our end here to make the decisions. Though I think I'm now connected, and in the last 24 hours, we've made a lot of movement. So I'm hoping that we can fast track those relationships. The challenges are there's a lot of people coming out of the weeds suggesting that they have tier 1 solutions. And when we go into deeper diligence, it's really a bit of a sham, or it's a tier 3 provider attempting either in a fraudulent capacity or just in a social good capacity to try to represent themselves as a tier 1. And with Health Canada regulations, we're going to need to really make sure the quality of the products coming in are tier 1. And so there's a primary focus there. There's a secondary focus right now in building a digital application that's going to be endorsed by a global party. We're not publicly announcing that, so I think we'll have updates on that maybe later in other Boma sessions and or in the next couple of days. But working with the team to help integrate digital technologies that were leveraged on the ground in Singapore, Taiwan, South Korea, regions where flattening the curve has been more successful, let's say, than perhaps in Europe and North America thus far, and attempting to integrate them into one application so that people are aware of what hyper local solutions are available to them in an attempt to assist in this dampening of the curve. I'd say I've kind of focused all my resources onto both of those for now.
That's fantastic.
Phenomenal.
You bring up an actually very interesting point about Taiwan, and that's something we'll share after this as well, which is what's happening in Taiwan and how that compares to Canada. Kevin, you have to sign off. Last words from you, please.
Yeah, first of all, I just want to thank you, and great to meet all the panelists that were here today. Thank you for the opportunity. I just wanted to clarify again that there is a huge opportunity for organizations and brands, right? Again, we talked about this purpose versus performance. It is not one or the other. Those two things can coexist. I think it's important about what it is and how we balance. Number one, we do know that when brands invest in purpose, they have long-term benefit to their business as well, to their bottom line. So again, I just want to stress that these two things are not mutually exclusive. The other point that I would just make to close out is, even amidst of our challenge right now, there's a magnificent opportunity for new brands, new opportunities, and new services to rise up out of this challenge that we're facing, to serve the many needs that we have now. We have individuals that are staying at home more and need to be entertained more, services for children. There is this wonderful opportunity to, out of this challenge, see a number of new small organizations rise up. And I think that in the midst of all of this, there is some type of silver lining, albeit small, within the greater challenge for those brands. So thank you. And I enjoyed the opportunity to say.
Thank you.
Thank you,
Kevin. Actually, a perfect tee up to the next. Diana, you should be able to speak now, I hope. Oh, 1 second. I'm gonna do that.
There she is.
Why? We're just promoting you to panelists, and for some reason it's because you're joining the webinar as a panelist. She's coming on as a panelist shortly.
Zoom folks, can you help us add Diana as a panelist?
And pardon?
Just asking Zoom that.
Okay, thank you. So as Diana is joining, she is with the Toronto Symphony, and they are working on some fantastic initiatives, talk about entertainment and how do you build community. So Diana, you're helping us round this out. We've talked a lot of challenging issues. What are solutions that we can move forward in, and how are you guys helping in the community in this important time?
Yeah, thank you for including the Toronto Symphony Orchestra in this conversation. I continue to be kicked out of this app, so I hope that it doesn't happen to me right now. But I want to say that I've been really, really touched by how, Duncan, for example, or Dr. Joordens have talked about, obviously, the mental health component, but also this idea of social connectivity, but physical distancing. And so at the Toronto Symphony Orchestra, we're a not-for-profit charitable organization, and really our mission is to reach people through orchestral music, enriching experiences. And, all of our concerts have been canceled because those are mass gatherings. So it's given us a real opportunity, I think, to Kevin's point earlier, an opportunity for us to determine what are the ways that we're going to reach our stakeholders. How are we going to continue to touch their lives? Because over the course of a single month of the Toronto Symphony Orchestra, tens of thousands of Torontonians have the opportunity to congregate, feel a sense of social cohesion, experience the creativity and beauty of civilization. And now we've taken that away from them. So some of the interesting things that we're doing really is about creating touching and intimate and relevant and empathetic digital content so that those people who are used to seeing us on a regular basis still feel connected to us, still feel like they have that relationship with us. And, one might say there's lots of great, music, digital content out there. Why do you need to create more? And really it's about furthering that relationship during a time that we're not able to see each other anymore. It's particularly hard for us as well, because a lot of our stakeholders might be older adults. They might be online, they might not be online. So we're taking also cues from our friends in the social service and healthcare sector. First of all, we're creating digital content that acknowledges their impact and thanks the people in the healthcare sector. But we're also looking at our friends at, for example, the 519, which is a community center at the Church and Wellesley area. They are implementing for their stakeholders friendly phone call check-ins. And so that's something wonderful that our friends are doing. And we know that our stakeholders, because they're maybe alone, could use that as well. So we're asking people what they want. We're learning from our friends in other sectors, and we're creating content to make people feel connected during a time when we're when we're no longer able to be in the same room.
Thank you. And I I got a clip of one of the impromptu performances that all of your artists did live, or and it all came together. So we'll be sharing that, and we'll be sharing others. And I think the biggest thing that I get from that, which is enjoy live music and connect when you can, even virtually, and call your neighbor, call the people you haven't called before. Don't wait for somebody else to organize that for you, but just go through your phone list and actually call and say, hey, what's going on? And also, how can I help? The term of unrestricted giving, I think is drastically important. And so thank you, Janelle, for bringing that forward. So we're 3 minutes.
We're 3 minutes until the hour. And so I'm going to Zoom, I'm going to promote Deep, I think, to
yeah. And before
panel.
we do those logistics, let's just shut down. Well, let's just close off ours and do that.
Well, I was thinking even just from a segue standpoint, from a global to local, and vice versa. But yeah, maybe you start there, and then we'll add Deep this one.
Yeah. So before we go to India, I just actually want to thank everyone that was on the line and that still is on the line. You gave us more than 2 hours of your time today, and that is super valuable. So thank you for bringing your perspectives, because we did hear some disagreements and we did get to that diversity. And I think with that, we are better informed to decide how we move forward. And I think more importantly, I think we understand the urgency from Amanda and John and Anil and Janelle and Duncan, et cetera. This is a real opportunity, and there is a chance to challenge the status quo. We have the opportunity to say, how do we move forward? We are in reset mode in many ways, in more ways than I think we can count. And when we question virtue and we question what truly matters, and we put that forward, I think we will be surprised to see we will definitely make different decisions and shape a different world moving forward. So the one last thing that I'm going to leave off with, and anybody that's on Facebook Live now, you'll see it pop up in the feed. I'll post it, and then please follow Boma, and we'll share it. We're going to connect you with all of the solutions. So we have a type form to be filled in, and we will gather information of where you live, what is your region, so that we can then properly give you the local information. Boma is a global community of local partners who connect, who want to shape a better future, a more intentional, intelligent future. And just on this call today, we've heard tremendous solutions, and we want to connect you to those. So I encourage you, look out for that type form link where you can fill in some information, and then we can make sure that you have access to the solutions on how you can act.